As part of a series of interviews with people in different backgrounds, careers, and professions, today's guest is someone that grew up in Southern California and was at one time a Burbank resident. I will be talking to him about his journey to get to and through medical school and what his next step is going to be. We're also going to be talking about some things that students should consider when they are looking at deciding on their own career path or profession. So, without further ado, let's get on with it. Welcome to the latest episode of Learning with Success, the show for parents of school-aged children, sponsored by Success Tutoring Online, helping students with academic progress for over 20 years. And I'm your host, Armando Salcido. Today, we have as our guest Mr. Michael Gribble. As a lover of math, science, and education in general, he considered several possible career paths, including general education, science, research, and engineering. He worked as a tutor for Success Tutoring, providing excellent instruction and assistance to students in higher levels of math and science, including calculus, statistics, chemistry, and physics. He was accepted into medical school at USC and graduated from there only a couple of weeks ago. Now he is on a short break before he begins his residency to become a radiation oncology specialist. Welcome, Michael. Thank you for joining us today.
Hi, Armando. So good to see you, and thank you for having me on the show.
Glad to have you. Now, having just recently graduated from medical school and about to start your residency, which you said could last between 3 to 7 years, can you tell us a little bit about how you got to where you are and what led you to this particular path for yourself?
Yeah, well, as you alluded to in my introduction there, I was interested in a number of different things from high school going into college. I think my first interest was like chemistry and physics. And, during high school, I got involved in a robotics team. And when I was applying to college, I was really looking at programs that had good engineering programs. And so at that point, I wanted to go into aerospace engineering. When I was applying to college, I ended up deciding to go to a school that did not have an engineering program, and I picked it for a number of other reasons. But when I got there, I really started enjoying my biology and math studies. So I decided to do a major in biology and a minor in applied mathematics. I explored a number of fields. Two that I became really interested in towards graduating were fields called astrobiology and biostatistics and epidemiology. So kind of intersections of biology with different fields. But what ultimately drew me towards medicine was, in both of those fields, they're research centric. And I found that the workflow of research and in academics just wasn't for me. It wasn't intrinsically motivating for me to be doing that type of research. So while I enjoyed kind of the subject of study, it was the day-to-day there that I was really having trouble with and couldn't see a career for myself in. So I started exploring after I graduated what it might look like to be in medicine, where I could kind of intersect my academic interests along with this emotional, personal calling that I felt. And so I began scribing in an emergency room and volunteering to gain more experience in that.
Very good. Now, you also said that it's pretty difficult to get into medical school. And not only do you have to qualify academically, but you also have to have some clinical experience. So now, why is it important and to have this clinical experience, and what are some of the options that people choose to gain clinical experience?
In my case, I didn't grow up in a family of doctors, or nobody in my family is really in the healthcare field. And I know that's the case for many people who want to become doctors and apply to medical school. So the reason why we need to gain clinical experience is just to know exactly what a doctor does on a day-to-day basis and how they really fit into this broader network of a healthcare team. What is the role of a nurse, or what is the role of a PA? What is the role of a doctor? And exactly what are those, individual nuances, and how do they operate together? And more than that, you want to be able to prove to the admissions committee that you've had valuable experience, and they're going to feel confident that you're going to make it all the way through school, and that you're going to go into a career where you feel kind of like this intrinsic motivation to do a good job, and to make it your calling.
Very good. Now, you mentioned that for your clinical experience, you worked as a scribe.
Mhm.
Now, can you describe what that is, and also how you like doing that?
Yeah, so a scribe is essentially a person who is paired one-on-one with a doctor, who follows them into patient encounters, which could be in the office, in the hospital, or in my case, in the emergency department. And while the doctor is talking to the patient, you're essentially doing the work of filling out their chart, their history and physical exams, importing any imaging finding into the chart, so that you're essentially taking a lot of the office work that a physician might have to do off of them, so that they're able to, be more present with the patient, and be more efficient in their job.
So you
Um,
basically are helping the doctor in a way so that he can really be what he's supposed to be, being the doctor.
Yeah, correct. And it's really valuable for somebody who's wanting to go into medicine to be a scribe, because like I was mentioning earlier, you not only see all these people in the health professions and what their roles are, but you're also forced to kind of pick up the vocabulary of medicine. It's almost like learning a second language, where there are all these kind of Latin derived words that we use in medicine, and it can be very daunting to learn at first, but you kind of get to dip your toe into that with being a scribe, because you're using that vocabulary in the charting system.
Definitely. In addition to clinical experience, what else is required to get into medical school? Would you have any suggestions that parents or students should know about, reference, website that they should review if they're considering medical school?
Yeah, so really the prerequisites for medical school, it's a set of courses, which range from biology, math, physics, chemistry, and things like that. So in my case, I did have a biology degree, so that helped a lot with taking a lot of the prerequisite courses. But many of my friends did not even major in the sciences when they were in college, and just added the prerequisite courses on top of their degree. So you can really have any major in college that you want to. You just need to take the prerequisite courses that the medical schools require. And you can find those listed on the AAMC website, which is the Medical Colleges Association, or on any website of the application pages of the schools that you're applying to. And then in addition to that, there's the MCAT, which is the medical college admission test. And so that is a 1 day, I think about 5 or 6 hour long test, which spans the sciences and sociology and psychology, as well as some English on there. And that can be a daunting test to study for. It took me a number of months while I was scribing, and that exam I had to take while I was doing night shifts in the emergency room as a scribe. So it's a particularly difficult test, and you want to kind of give your all for it. Like, it was helpful for me because I was out of college when I was doing this, so I wasn't having to take multiple classes on top of all this work I was doing. But I have had friends who went straight through college, and you do have to start doing this stuff around junior year of college. But that's becoming less and less common to go straight through. Most people take a little bit of time between.
So you completed your college degree in biology and some of these other specialties or
Mhm.
interesting, and then basically we're working. And while you did that, you studied for the MCAT, got that done, and got some of your other, I guess, requirements out of the way.
Correct. Yeah.
Okay. Now, what about costs? Now, going to college itself can be expensive.
Hmm.
And my understanding is that now going to medical school also can be very, very expensive. Now, we could probably do a whole show on how to manage costs for college, and well as set up, financial strategies for college and beyond. And for that, I would probably have to talk to a college financial counselor or something like that. But without getting into all the strategies and all the possible ways for handling finances, what should parents know about the costs involved with going to medical school? With college and going to medical school,
Hmm.
and any ideas or suggestions that you would have for what they should do to prepare for this?
You're exactly right. Both college and medical school can be extremely expensive. With regards to college, I think, like I was mentioning earlier, there's many paths to get into medical school, and the college that you attend has little bearing on if you get accepted to medical school. There's certain things you want to look for, as in like having a good pre-med advisor at your school or a track record of students getting into medical school. But beyond that, it really doesn't matter if you're going to a private school or a state school or things like that. And I ended up choosing a private school because it was cheaper than the state schools for me based on the scholarships I got. But if that's not the case, then state schools will likely be cheaper, or you can go to a community college for a couple of years and then transfer to a 4-year university. But I would say for college, minimizing the amount of loans you take out during college is extremely important, because colleges are more generous with their financial aid packages than medical schools. When I got to medical school, I wasn't offered any money, and USC is an expensive school, and so I had to take out a lot of loans. So my advice with that is, you should be taking out exclusively loans from the federal government, instead of private companies, because those federal loans are eligible for student loan repayment if you work in nonprofit sector for about 10 years, and the government will forgive the rest of your loans if you do that. So that's an option. But if you don't do federal loans, then your private loans would not be eligible for that. I think right now the average student loan debt coming out of medical school is a little bit more than $200,000. And, that seems like a lot. And it is. That can be really daunting to take a hold of, especially as you're going to residency first after graduating and not making a whole lot of money for, 3 to 7 years. And so during that time, the interest is racking up. But it's important to kind of explore these other opportunities, like the public student loan forgiveness when you're in medical school, or just get most people are going to be making enough money after graduating residency in order to repay this, and so it may take a long time, but physicians are well compensated, and the loans that you take out in medical school are large, but they're able to be repaid on a physician's salary over a given amount of time.
Good. Now, once you complete your residency, you're going to be a specialist in radiation and oncology. Now, can
Mhm.
you explain a little bit about what a radiation oncologist is and does?
Yeah, so radiation oncology is the treatment of cancer with radiation. And that can seem kind of counterintuitive, because we know, like, UV rays, for example, are radiation, and they cause cancer. But using a specific type of radiation can actually obliterate cancer. And so we use it both for the treatment of tumors and for the treatment of post-op sites, so essentially where tumors have been removed in order to kill, microscopic tumor cells that may be remaining after surgery. So it's part of this kind of three-pronged approach in cancer treatment, where you have surgical oncologists who may remove the tumor. You have medical oncologists who are treating with chemotherapy and immunotherapy, so all the drugs that you may receive in the infusions. And then there's us as radiation oncologists who use photons, protons, electrons, and very precise beams in order to treat either, like I was saying, gross or like macroscopic tumors or microscopic tumor cells.
Wow, that's great. Usually, when you think of photons and things like that, you're thinking Star Trek, photon torpedoes, and very futuristic things. So I guess there's a practical application then, huh?
Yeah, it's really cool. It's one of those unique fields in medicine where, I like I was saying, I had this huge interest in engineering and physics before going into medicine, and I feel like it's kind of a diamond in the rough for me, where all my interests have aligned in this field, and I'm really happy to be a part of it.
Very good. So the profession, as you've mentioned, is very specialized, and it requires an incredible amount of study and preparation. Now, how did you come to the decision to do what you're doing?
Yeah, I think for me, like I was saying, I had a lot of interests and I was seeking those out as if I was going to do them as a career full time. I didn't know that I wasn't going to be an engineer or a physicist or a researcher when I was in high school or college. I thought I was going to do those things, and ultimately, just trying them out and figuring out that they weren't for me was extremely important. And then in terms of kind of exploring medicine, me not having people in medicine in my family that I could ask about, it was really important for me to find mentors in the field. And I ended up having somebody connect me with a doctor at Cedars-Sinai who I shadowed and volunteered with for a while. And he was an oncologist, a medical oncologist, actually. And kind of seeing his work and also having him as a person to ask questions to about the process of medical school and what it's like afterwards, and his job as an oncologist was extremely important for me. So I think it's really important to find those mentors, and don't be afraid to ask them to lunch or to send them a few emails or to have a phone call and just really get an idea of what the pros and cons of their job are, because every job is going to be, it's going to have great parts and it's going to have really truly awful parts. And if your calling kind of aligns with it, then the bad parts are less bad. But finding that out before you get into medical school about what is the job of a doctor, if you have an idea of what is the job of a specific type of doctor that you want to be, that can be helpful. But ultimately, you do get experiences in medical school that allow you to explore all these different specialties. So that's helpful as well.
Very good. Now, you mentioned that one of the reasons for requiring a clinical experience is to show that the person can make it in the medical field, that they have the courage, the confront, and character for dealing with medical situations. Now, a person can be very knowledgeable in the subjects of math and science, but if they faint at the sight of blood or become squeamish when seeing physical trauma, or just can't really deal with people, they probably would not be cut out for being a doctor. So, what would you say to students that are looking at different possible career paths, not necessarily medical school, but any career path? What are some important things that you think they should consider?
Yeah, well, let me address like a couple points there. First
Sure.
of all, you were kind of talking about the purpose of clinical experience, and we talked about that a little bit. I would say it's less like a kind of a cutthroat approach, like where if you don't like your one experience, then you shouldn't be going into medicine. It's more like trying to help you find, if this is going to be what you want to do. And I think it's important for people to be honest during that period of, you don't want to have pressure from anybody else in your family or from even yourself to become a doctor if that's not ultimately what you want to do. So having that clinical experience before you start this long journey, where once you're kind of in it, you really kind of have to see it through. Um, Going into medical school is that step, to decide if this is truly what you want to do. And so that's why that clinical experience is so valuable. And then you were talking about, I know, being squeamish or things like that. I will say, like, I'm a little bit squeamish, and radiation oncology is not particularly a field where you have to deal with a whole lot of blood or things like that. There's minor surgical procedures, but nothing too serious. But you can go into medicine if you don't like blood, or you don't like surgery, or you even faint at that stuff. We've had people faint during anatomy lab and things like that.
Wow.
There's many fields like pathology, where you're looking at slides, microscopic slides, or radiology, where you're analyzing images, where you really don't have to deal too much with the blood and the gore of medicine, if you will. So those are kind of some hopes for people who may have those setbacks. And then we were lastly kind of talking about like general career advice about what to look for when you're exploring different career paths. And I'll really just go back to mentorship. I think it's so underutilized. Just asking for help, and reaching out to people who are doing the thing that you're interested in doing. And really, whether that be show up for a day at their work and shadow them, or just get them to talk about what they like and don't like about their job, or what opportunities it's offered them, is so valuable. And I really can't recommend it enough for people who are exploring different specialties. So when I was exploring engineering or being a professor and doing research, I thankfully had people in my life who were doing both those things in college. And I just asked them a lot about, what exactly they did. And I volunteered and I did research. And through that, I was able to find that it wasn't for me. And then similarly, like I mentioned before, I found a doctor through a friend who I got to shadow, and that was ultimately enough to help me make the decision to apply to medical school.
That's good. I think I mentioned to you also that one time I had this idea for this business that I was going to do, and it sounded like a great idea. I thought it was good. It was something that I knew that I could do well and be good at. So I set it up and kind of tried it out for trying, free service to some of my friends and relatives to see if I even like doing this. And so I did. I tried it out. I helped out some friends and family members. And after just a little while, I realized immediately this was not for me. I did not like it. And so, what you're saying, I think, is very important to find out what do you like? What do you want to do? And it's important also to find out what you don't like, you
Hmm.
know,
Hmm.
because you don't want to get stuck into a something that you absolutely hate. The worst thing in the world is to feel like you have to force yourself to get up to go do something that you hate doing.
Hmm.
That's the absolute worst. You should ideally do something that you enjoy, you like doing, you feel like you are doing something of value and helpful, and that is rewarding, you know. And that's really what, ideally you should be looking for. After high school, you went to 4 years of college. Then you spent time gaining work experience as an educator by working as a tutor, and then working in the medical field as a scribe while you diligently worked on handling all of the steps required to get to medical school. Then you went to 4 more years of medical school, graduated only a couple of weeks ago, and within the next 2 weeks, you're going to be starting your residency or specialization, which will probably last another 5 years or so. Now, what would you like to say to any students that are considering a possible career in the medical field, and especially anyone that's looking to become a doctor as a general practitioner, or as in your case, to continue with a very specific medical specialization?
Hmm. Yeah, I think this is a good question that kind of sums up a lot of points that we've been talking about. A lot of people that I've talked to were interested in becoming doctors before I was. I think I made the decision a little bit later. But an important thing to remember is that it's okay to make that decision whenever you like. I have some friends who have known they've wanted to be doctors literally since they were like 5 years old because their dad or their grandpa was a doctor, and they knew that that's exactly what they wanted to do. But I also know people who were in their 30s before they made the decision and had multiple other careers that they pursued before they realized that they wanted to go to medical school. So
Wow.
an important point to make is, the timeline is yours. There's no specific timeline you need to be on. For me, that meant I took 2 years after college to kind of get that experience and build up my application for medical school. But you can spend longer than that, or you can go straight through. And then my other point would just be when you're in high school or when you're in college, um, if you have other interests, you should pursue those as well. I think something that a lot of admission committees look for, whether that's college admission committees or medical school admission committees, they want to see that you have interests and that you're kind of committed to them. So more than trying out like this club and this club or this extracurricular, to be dedicated to something that you enjoy will really shine on your application. And more than that, it'll give you personal fulfillment and really help you make these decisions about what you want to do. So I was volunteering a lot throughout college and traveling to other countries to do kind of humanitarian work. And that was part of my decision to go into medicine because medicine has similar aspects of, you know, all hands on deck, boots on the ground, like, uh, you're face to face with patients or people in need, and you can provide a service for them. So that was something I tied into my decision making. So I think for people who are thinking about pursuing medicine, the timeline is yours, and then pursue whatever interests you have during high school and college, and just go all in because you may be surprised by what you're motivated by and what you like to do.
Very good. I tell students all the time to do exactly that, to explore different areas so they can find out what they like, what they don't like, what they're interested in. Um, well, that leads into my next question. Now, so you obviously have spent a lot of time studying.
Mhm.
Um, so now, as we at Success Tutoring Online, we work with a lot of students to help them with their academic progress. What would you say to students about the whole subject of studying, learning, and succeeding in school?
Yeah, so there's a lot of exams, a lot of milestones that you need to achieve on the road to medical school. And that can be daunting if you look at it all at once, but it really is just is a stepwise process. There's actually been research done in education and learning and what are the effective techniques for learning. And when you get to medical school, you are kind of forced to use them because you have such little time and there's so much information. And the two that are really the top tier learning methods they're called spaced repetition and then simulated practice. So spaced repetition is like you're seeing the same information, but over a span of days or weeks. So that might look like using a flashcard app and having it reset every couple of days so that you're seeing the same information maybe every 4 days or every 7 days or things like that. And then the practice is, you're actually simulating the testing environment. So you're, using practice exams that your teacher gives you, or you're making your own practice exams, and you're simulating that test environment so that when you get to test day, it's nothing new. You've seen it before. And so I did both of those during medical school and worked very, very well. It's far more efficient than the reading the highlighted notes that I was doing before or whatever in college. And so really that is the most effective tool that you can use. But obviously, to get there, you need to have understanding of the material, and that's kind of where these things like tutoring and just like overall like classroom education comes in. Is you're beginning to master the subject and to gain that foundational understanding. You can't have repetition or test take if you don't understand the core material. And kind of on this journey, you're building one piece of information on top of the other. So it's important that you have foundations before you move on in college and in medical school. And for me, I, like you were saying in my introduction, I tutored a lot of these classes, like calculus and advanced physics, that when I was tutoring, I hadn't seen that material in a number of years. And I had to go back and look at textbooks and look at YouTube videos before I was actually able to teach it. And ultimately, teaching is mastering the subject. And so if you can get to that point where you've repeated the information and now you can teach it to somebody else, that is going to stick in your brain for years. And that's more than just being able to answer tests. That's, now you have that information, you truly understand all aspects of it, and that can come at you. And so I actually was a tutor during college as well. And it was really helpful for me to tutor kind of the more foundational curriculum before I could move on to these advanced courses. I felt like I had a leg up because I was seeing the same information over and over again, and I had truly mastered it by that point.
That's very good. Students, as a general rule, a lot of times try to just, get through the class, do the minimum possible to complete and get the best grade possible. But I tell them that not to focus on just the grade or even a test, but actually understand the material, right?
Mhm.
So, some students, they have to really read everything very, very carefully. Some not necessarily as much, but the whole idea is to understand it. And again, it's for application. So if you can learn something so you can apply it, then you have learned it. Like whether you are teaching somebody else, showing them how it's done, or using it yourself. And that applies really to any subject or topic, whether it's an actual physical thing that one does. Like I use the example of learning to ride a bike. If you have learned to ride a bike, that means you can ride a bike. If
Mhm.
you've learned to play the piano, that means you can make music by playing a piano. um, and the other example is just learning the fingering for, chopsticks does not mean that you have learned to play the piano. You have memorized this. So the same thing, if you are learning something in calculus, if you try to just memorize your way through, you're not going to be able to really use it. You have to understand the concepts. And as you said, you have to know these fundamental basics that you have built on to understand then calculus and look at how it's actually used. And if
Mhm.
you go from that viewpoint of application throughout school, K through 12, and especially in high school, you're building the foundational steps needed to get into the higher level of the classes that you're talking about. When you get into the really high level of higher level calculus, or differential equations, of organic chemistry, of astrophysics, and all kinds of things. So but see, you have to know and understand these earlier basics. And even though they are, like, calculus is considered a higher level math, and it is, you have to know that so that you can get into this higher level stuff, so that you can then get into a career like what you're doing now.
Yeah, yeah, absolutely. I think the foundations are vital. And the nice thing about the road to medical school is, your grades do matter, but we talked about this already. It's not the end all be all, and nobody sees your grades until it's on your college diploma when you're applying to medical school. So, when you're in high school or early in college, it doesn't matter that much, and your mastery of the subject is far more important than whatever grade you're receiving.
Exactly. And if you do understand it, what happens is usually you can then get a better grade. Whereas if you
Absolutely.
go for just the grade, that doesn't necessarily mean you get the understanding. Well, okay, Michael, and we've covered quite a bit here today. Is there anything else that you would like to say to either parents or students about school, study, college, choosing a career path, or deciding to go into the field of medicine?
Yeah, I would say kind of my two pieces of advice that I've learned from my own journey would be number one, like try not to idolize any career. I think when we grow up, we have an idea of like, I like my example, I really wanted to be, a researcher or an aerospace engineer. And I think if I had stuck myself on that path, I would have done it, but I would have been a little bit unhappy. But ultimately, my ability to be honest with myself during that process made all the difference. So I just say, don't be tied to anything. Be honest with yourself about, what actually truly works for you in your career path, and as you decide that through high school, through college, or beyond. And be flexible. And the second part is like it's okay to change your mind. Again and again and again. People have multiple careers, and that process can be short or it can be long. But I think it's okay. Whatever decision you're making at the time that you're making it is based on the information, the experience that you have. And getting to seek out multiple different careers is so helpful when you're in high school and college. Because you get to see the world that's out there that you don't get to experience otherwise. And I think that's so important for people going through that kind of later education stage.
Very good. I do tell students they should have a goal to work towards. Now, it may change and probably will change, but if they have
Hmm.
a goal to work towards, they can see how what they're studying or what they're learning applies to that, as opposed to if there is no goal at all, because a lot of times students don't know what they want to do. So if they have no goal because they don't know what they want to do, what happens is when they go through school, all their classes, it's just a surface learning experience. It's not really looking at how to apply it, how to learn the material for application. And so they kind of get just a surface understanding of everything as opposed to a more, deeper understanding.
Yeah, in my case, when I was in college and looking into research fields, I was trying to get my research published, and I was traveling to conferences around California to present my research. But the research had nothing to do with medicine. But when I got into medical school, I've actually talked with a lot of people, in radiation oncology through my interview process who have kind of looked at that research and have found interest in it, and it's a really cool talking point. So even though it wasn't something that was dead straight on the path to medicine, it's ultimately informed my decision making, and it's also helped me get where I wanted to go ultimately.
Yeah. So no matter which way you go and whatever your goal is, even if you change it, you gain valuable experience and knowledge from that.
100%. Yeah.
Yeah. So, okay. Well, Michael, thank you very much for joining us, and thank you very much for sharing your thoughts and telling us about your journey. And I think it'll be important for parents to know a bit more about, what things they should look at. I mean, a lot of times students think they want to go into medicine, and parents think they want their kids to go into medicine, but may not actually really know what it takes. And it takes a lot of study, a lot of knowledge, a lot of dedication, and quite a rounded experience.
Yeah, if it's the field for you, then it's such a beautiful experience. And if it's not, then it's punishing. So, uh, So it's for me, it's the most rewarding job I could possibly be doing, and kind of this whole process is, it's one step at a time, but it's really beautiful.
All right. Well, again, thank you very much for joining us today. And I will say we'll talk to you later, but I know that, very soon you're going to be starting your residency and you're going to be very busy.
Yep, unfortunately. But thank you so much, Armando, for having me on. It's
Definitely.
been a pleasure.
Okay. Well, okay. Thank you. Bye.
Bye.
I want to thank all of our listeners and all of those watching on YouTube today. I hope that you have found today's show to be valuable and informative. If you liked today's show and you haven't already, please subscribe so as not to miss any future interviews. Right now, I have a nutritionist scheduled that will talk about how to get kids to eat healthier meals and why it is that parents always feel like they are fighting a battle against food manufacturers that offer fast food, sugary snacks, drinks, and breakfast cereals, and what parents can do to get their kids to eat healthier, more nutritious meals. I also have the new principal of a local high school scheduled to speak with me as a guest. That's coming up soon. That'll be very interesting. And I also have a Tesla engineer interested in coming on as a guest, as well as others. So subscribe so as not to miss out. In the meantime, this is Armando Salcido signing off, and I hope to see you again next week. As mentioned at the beginning of the show, Learning with Success is sponsored by Success Tutoring Online. Our administrative offices are located in Burbank, California, but we provide tutoring or academic advancement to students throughout the United States.